Hello, I'm Dr. Claudia Kim. Today I'll be talking to you guys about a mommy makeover and exactly what does that mean and what does it entail. Pretty much a mommy makeover means that there is multiple procedures that are being done, commonly after having children or after a significant amount of weight loss. Okay, so those areas that we address are usually the breast, the abdomen, and sometimes some extra parts like the back or the butt. But generally the term refers to the breast and the belly area. For mommies who've had children or for individuals who've had a significant amount of weight loss, you're going to see a couple of changes to your body, especially if, let's say, you had breastfeeding. Obviously, the pregnancy changes everything about your body. Your breast can be deflated, your breast can actually get much larger, they can sag, one nipple could be pointing this way, another one that way. And you can also see those changes with weight loss because obviously your breasts do consist of fat. So if you lost a significant amount of fat, then your breasts can be deflated, right? And if they were heavier, then they've sagged. And same thing for the belly. You've had an extra, kind of fluff around the midsection area. And once you lose the weight, you'll see that there is that loose skin. So this term doesn't always apply to mommies. We can kind of put that into a category of a lot of people. For the breast portion of the procedure, we can actually address deflation with a lift. So if you just need a little bit of a boost, that's what we call the mastopexy or breast lift. Now, some individuals may want a little bit more volume because they've seen the deflation of the breast. In situations like that, we can put an implant in, or a silicone implant, or in some individuals, we can actually do liposuction, getting fat from somewhere else, and putting it into the breast for a little extra volume. For people who wonder if I need a breast lift or not, okay, there's a little simple exercise that you can do. You take a little pen, okay, you put it underneath the boob. This is called your inframammary fold. This is where the breast folds down across the chest, right? So you put a pen there and you see if your nipple is actually going underneath the pen. That indicates that you are going to need a lift, right? So with the lift, you're taking the same amount of breast tissue and just tightening things up to make them a little bit more perky, and you're lifting up the breast. It doesn't change the volume of the breast, so the size of the bra that you wear is not going to change. They're just going to look a little bit perkier. Now for breast augmentation, which could be with the implant or with fat grafting, you're adding volume to the breast. So some people may want to pursue some larger breasts, and then we can talk about that. Now, the difference between the breast implant and fat grafting also varies. So an implant is a device, right, that you're going to change out every 10 years. You're still going to have the same kind of maintenance with breast cancer screening and everything with any kind of breast procedure. With the breast fat grafting, you're taking your own fat and adding the volume. It's not going to give you as much volume as an implant potentially can have, but it can add about a half cup size to a full cup size in terms of the size. So that's fairly straightforward with the breast. Now for the abdomen, okay? Now, a lot of women after pregnancies, and especially multiple pregnancies, notice that their belly is not as flat as it was before pregnancy. And this actually applies to people who are heavier or even individuals who are on the thinner side. So you can be very fit, you can be very thin, but then after pregnancy, you'll notice that the belly sticks out. This is most commonly due to what's called diastasis recti, which means that there's separation of the muscle. So the uterus is obviously in your abdomen, your pelvic area, and as the uterus grows, it stretches everything out. And sometimes with that stretching of the muscle, the separation of the muscle doesn't come back to where it was before. Now you may ask, why are there some women out there who've had multiple children and their belly is right back to what it was before? That really depends on the individual. Now, people who are active and very fit and they do have a very strong core prior to pregnancy find that the bounce back to their pre-pregnancy body is much easier because they've developed the baseline for having that strong core structure. Now, in some individuals, obviously depending on what your obstetrician says, you should exercise before pregnancy and during pregnancy as well to at least get you to, your pre-pregnancy weight as close as possible. Now, if that's not the case, okay, then the tummy tuck is addressing that muscle separation. So obviously with the tummy tuck, we are addressing the loose skin or the hang of the skin. And we also do what's called a muscle repair or a muscle plication. So essentially what we do is we put a stitch, a suture that acts like a corset, and you bring the muscle separation together to kind of bring up the cage of your abdomen tighter together, so all of your belly muscles are nice and tight to bring it back in. In some individuals who, let's say, had massive weight loss, it's not the uterus that had pushed out the muscle, but it could be due to intra-abdominal fat. So you have subcutaneous fat and you have intra-abdominal fat. They're two different types. The subcutaneous fat is the fat that's sitting on top of the muscle, and that's the stuff that we can remove either with a tummy tuck or with liposuction. But with intra-abdominal fat, this is the fat that's inside or behind the muscle that surrounds your organs. And so that also acts as something pushing up against the abdominal muscle wall and separates the wall. Depending on the person, depending on the situation, we can actually address that during a tummy tuck. The extra stuff that we do in conjunction with the mommy makeover. So I kind of talked about one of them, it is liposuction. Sometimes we do have to combine a little bit of liposuction to really bring the waist and cinch the waist together. And that can involve liposuction of the love handles, of the back area, sometimes the arms, sometimes even liposuction of the little armpit fat or on the sides here. So we do, discuss these extra things that would make a whole picture look complete. And then with the fat, you can use that extra fat to either put it into the breast or put it into the butt, what we call a Brazilian butt lift or a BBL, or fat grafting to the buttocks and the hips. Obviously, the more things that we tack on is going to be a longer recovery. Now, we're going to transition into the recovery and what to expect after each procedure. Now, the first thing that I always ask is, how old is the youngest baby? Because people don't take into consideration what you cannot do after a big surgery like this. So first, when can you do the surgery? So ideally, I do like to wait 6 months after breastfeeding to address the breasts, okay? And same 6 to 9 months to do a tummy tuck after giving birth, because that really allows the body to kind of heal and to get as close to what is normal or baseline before we start changing things up. So if you're thinking of that in terms of when should I plan for surgery, about 6 to 9 months. Now, for the recovery, okay, the restrictions after surgery is that you're going to have to take about 2 weeks off from work. Depending on what you do, that might be shorter, that might be longer. If you're working remotely at home, you may actually be back at work in about a week. Or if, let's say, your job is very labor intensive, I may say take off 3 weeks off from work, okay? But generally, on average, take about 2 weeks off from work. The other restriction that you have is that you cannot lift anything heavy greater than 20 pounds for 6 weeks. Because if I am doing the muscle repair, so that suture is kind of bringing all the muscles together, you can't overexert yourself and you can't overexert your core, potentially altering or messing up the stitch or the corset that we did. So why is that important? If you have a young child or if you have other young children, little things like picking them up to put them into the bathtub, putting them into the high chair, putting them into the car seat, that's going to be very tough for you to do. So you do have to plan the good support system and see who's going to be able to help you out during your recovery process. And this is something that a lot of patients don't consider, and when I bring it up, they're like, oh, okay, so maybe we should wait a little bit of time. The other thing to consider is that you should wait until you're done having children, right? Because after all this work we did and all the recovery that you went through, if you end up having another pregnancy, the same thing's going to happen. Your uterus is going to expand, your muscles are going to be, stretched out, and so potentially you may need another revision a couple of years down the line. So I do say if you are considering a surgery like this, is to make sure that you are done with having children or you're pretty much at a stable weight. Okay, so you're not going to continue to lose more weight or you're not going to gain, try to be in a stable state so we can correct whatever issues that you have at that moment in time. The other thing that we can probably discuss is with the breast augmentation. So with implants, same thing, you cannot lift anything heavy with your upper arms because the implant most commonly is placed underneath the muscle. So you don't want to compromise that by lifting things that are heavy. So obviously for my new mommies, always put that into your game plan when you're planning for surgery. After surgery, so we talked about how many days you should take off of work. We talked about what you can and cannot do after surgery. The other things that you have to consider is that you do have to wear a compression garment, right? So especially when we're addressing the abdomen, you do have to wear something that's tight to kind of keep everything secure. So for that, I do recommend wearing it for at least a month to 2 months, depending on the scenario and depending on what extra procedures that we do. So keep that in mind. If it's 115 degrees, then you have to remember that you are going to be wearing a compression garment for a significant amount of time. The other things that I do say is that when you're traveling, so if you are coming from out of town, you do have to stay in the neighborhood, and this will be surgeon dependent, but for my patients, I do say stay nearby the office for 2 weeks after surgery. Okay, you can't fly afterwards, but I do want you close by just to keep an eye on you for any complications or issues that may present immediately after surgery. The other thing to take into consideration is that after a tummy tuck, I do leave drains. Okay, now these drains are placed in the groin area and they come out after about 7 to 10 days, depending on the person. So ideally, be in the neighborhood or at least be accessible for me to take out the drains. And then if everything is good to go, you may return back home and we will follow you remotely, or at least with scheduled phone calls, with video chats. And then if you do have an opportunity to come back to New York, then we'll do other follow-ups at that point. Now let's talk about scars, right? So the tummy tuck scar, it'll depend on how much skin we need to address. If there's pre-existing scars, if you've had other surgeries to the abdomen, that may change our game plan. If you've had a C-section before, so all of my tummy tucks, if you've had a C-section scar, they go underneath the C-section scar, so there'll be one fine line. And if you have, let's say, a lot of loose skin that's going down to the love handles towards the back, then you're going to have what's called an extended abdominoplasty or extended tummy tuck, where the incision is going to be longer to address kind of that side fluff. Or if you are, let's say, a thin person with just a little bit of loose skin in the lower abdomen, then your scar will be shorter. It's hidden very well underneath the bikini top or bikini bottom. The only visible scar you'll have is the belly button, but it's usually not noticeable unless you're really up close and staring at the belly button. Now for the breasts. The breast incisions are, depending on if we're doing just a regular breast augmentation or fat grafting or a breast lift in conjunction with the tummy tuck. So with the breast augmentation, it's going to be a small incision right underneath the breast. It's quite invisible if you have a bikini top on or a bra on. Versus a breast lift scar is going to be depending on the patient, but it can potentially be around the areola, down to the bottom of the breast where the fold is, and it may be a short scar underneath the inframammary fold or the breast fold. But it should definitely be hideable with your bikini tops or your bra tops, or even if you were to wear a low-cut dress or a low-cut shirt, it should be invisible. Other things in terms of the extra modalities that we can add on, which is the liposuction and fat grafting. That also extends the recovery time and the recovery process. Obviously, with fat grafting, there are other limitations and restrictions. So if we are doing fat grafting for the butt, for my patients, I do say you can't sit on your butt for a prolonged period of time for up to 4 weeks. So how does that translate into the recovery time? So obviously with the breast and the tummy tuck procedure, you have to sleep on your back, right? But if you're doing a BBL in conjunction with the front part of your body, you can't put pressure in the back. So it does get a little bit tricky. So there will be kind of contraptions and sleeping positions that you can have, but things like that, if you are an avid stomach sleeper, are you going to be able to rest for the 4 weeks? So little things like that, I feel like it's very important for surgeons to set expectations for patients and to really understand the step-by-step process of what you're going to expect and what you can and you cannot do, so you can plan appropriately. Some tips and tricks for a smooth recovery period. Okay? So I usually say get all your supplies in advance, right? So have everything ready, have all your dressing stuff, have all the clothes, have even things such as, let's say, things on your upper cabinets that you like to get, like plates and dishes and things like that. If it's on an upper cabinet, bring them down, right? So little things where you don't have to strain yourself during surgery. And obviously have all of your stuff that your surgeon has recommended you to buy, whether it be dressing supplies, scar tape, band-aids, garments, things like that. Just have everything ready so you don't have to rush and just try to go find them last minute. The other thing is have a good support system, because you're going to need them. This is a big surgery. Obviously, it's to the breast and for the tummy and potentially for the back. You need help, okay? You won't be able to do this alone. So whether it be a family member, a friend, a partner, just make sure that they are understanding and they are on the same page, that you're going to have to rely on them for the first few days. And a lot of the times it's hard for moms to try to step back and let somebody else do everything, but for optimal healing, you're going to have to kind of, put your hands up and let them help you. For the first few days after surgery, you just want to rest. Okay? Do minimal things around the house. Really do refrain from doing any cleaning or any kind of, laundry and things like that for the first few days. Now, after the first few days, when you start to feel a little bit better, you can be more active. You can go for walks as long as you're comfortable, okay? You can do little light stuff around the house, but again, you still need to be aware of how much exertion and how much, overactivity that you're doing, just so you don't undo anything or potentially hurt yourself, to prevent optimal healing. Now that we've talked about what is a mommy makeover, there are certain things that you should pay attention to when you're looking for the right provider to perform the surgery on you, okay? So obviously you need to make sure that someone is accredited, right, and board certified and knows what they're doing and they have experience, right? That's number one. The second is to really see if that person and you have the same goals in mind, right? So maybe you have a certain image in your head and the surgeon has another idea, okay? So you really have to be on the same page on what your expectations are, and you have to get along, obviously. So in my practice, I stay very close in contact with my patients after surgery, because the initial period is the most important to make sure that you have the best results. So we always make sure that the patient comes in immediately after surgery, and then again a week after surgery to take out the drains, and then we meet up again after that. So we do quite frequent post-operative visits, just because I like to make sure that my patients are in perfect condition, to make sure that they have the nicest recovery and the nicest results possible. Hope that has answered a lot of questions that you guys might have on what is a mommy makeover. If you have any specific concerns, or if you'd like to see if you are a good candidate, obviously you can contact me in the office for a private consultation, and then we can kind of see what we can do for you. If you like more videos like this, check out our other videos. We'll be doing a lot of talks in regards to surgery. So hopefully you guys enjoy these videos.